I think the hardest part of the 2 week wait is that your body is full of progesterone and you are thinking about every symptom, and that high progesterone symptoms are just the same as pregnancy symptoms. And I remember when this was happening to me, I was obsessive about tracking my cycles. I should have bought stock and pregnancy tests because I took so many of them. And every little twinge symptom, I read into it. If I had cramping, if I had breast tenderness, if I felt nauseous, could I be pregnant this month? And was I pregnant enough to stay pregnant? So if you are driving yourself crazy or constantly thinking about your symptoms in the 2 week wait, you're not alone. But I do think it's important to think about how pregnancy tests work and to make a game plan for the 2 week wait, because it feels sometimes like you're on a hamster wheel doing the same thing over and over. And I know that can be extremely frustrating, in addition to just emotionally and physically challenging. So urine pregnancy tests are ones that are detecting urinary HCG. When we do blood pregnancy tests in the fertility clinic's office, we're checking HCG in your blood. Now, blood tests are always going to be more sensitive, meaning we can check and detect lower levels of HCG. On the urinary-based test, there's a few different ones out there. How they work is that HCG is released into your bloodstream. So the embryo is making HCG that goes into your bloodstream. It's going to get metabolized and has to get processed through your kidneys to get into your urine. And what you're doing is these are urinary tests. So a pregnancy test, you urinate on it on the strip, and then your urine sample moves along and there's a control and a test line. And so if there's any HCG, it's going to bind to that test line. Now, pregnancy tests can be digital, and they can also be ones that are a line of some form or fashion. Typically with the line ones, you'll have a control line, and that will either be a straight line or some markings that will say control. That one should always show dark, and if it doesn't, the test may not be working correctly. The test line, however, is not like an OPK. Remember, in an OPK or an ovulation test, which is checking the LH hormone, because LH is present all the time, we need that test to be as dark as the control or greater to be accurate. But for a pregnancy test, any line, any sign at all, even if it's extremely faint, is a positive test. And just to give you a little bit of insight in how much this can vary, because in clinic, we do urine tests and blood tests all the time. We can see a very, very faint urine test, and you still might have a very high HCG level. That's because there's so many other factors that go into the urine about when it was metabolized and how dilute or concentrated your urine may be. But any line at all is a positive pregnancy test. That's a really important thing, because I will have people tell me, oh, it was just light, so it wasn't really positive. But that's not how it goes. That test is not positive unless you have HCG in your body. The one thing I always think is really important here, especially for people who might be doing fertility treatments, is that if you had a cycle that got a trigger shot forces ovulation to happen. It is actually a high dose of HCG. So remember, because HCG and LH bind to the same receptor, if I give a high dose bolus of HCG, it will cause you to ovulate just like a surge of LH does. And why do we give HCG? The short answer is we don't have an isolated LH compound that we can give you. That's why if you're doing fertility treatment and you need some LH to grow your eggs, you take FSH that's isolated, and then you take a hormone called Menopur, which is a combination of FSH and LH isolated from menopausal women's urine, because both FSH and LH are high in menopause. But we don't have an isolated LH. So when you get a trigger shot, you're going to take a big HCG shot, and that's going to cause ovulation to happen. But that means your pregnancy test might be pregnant well earlier because of it. And I think that's something that we have to be aware of. This means you need to wait even longer to take a pregnancy test if you used a trigger shot in your cycle, or you have to do something called testing out your trigger. The idea for testing out a trigger is a lot of pregnancy tests. So please do not do unless you are crazy like me. But what you would do is you would take your pregnancy test every day and you would watch the HCG line go from positive to negative, because we know it's going to be positive from the HCG. And then once you get to that negative value and the trigger shot is out of your body, you then, if you see another positive, will see the line get darker. In perfect practice, it doesn't always happen. Sometimes you just perpetually stay positive. It might get lighter and then darker again, depending on when implantation is actually happening. So I just think that's important to know, because I've had some people call and say, I have a positive pregnancy test at day 6 after my trigger, and it's really just the trigger. For most people, it does take about 6 to 8 days to get that out of the body completely. Now, if we are checking a pregnancy test, when can it detect that you're pregnant? This depends on the test manufacturer and how sensitive they have made the control in the test line. So in most pregnancy tests, standard is that you have to have an HCG level of about 20 to 25 MIUs per ml in order to detect a positive. Well, some of these early tests, now you're going to pay more for them, but you might notice if you go look at your pregnancy test on the counter, some that say early results, earliest test you can take. These have a lower HCG cutoff. So they actually are more sensitive. So if we see that, their cutoff is usually at 10. So you will be able to detect an earlier pregnancy with one of those early tests. So if you are somebody who wants to check early, those are going to be the tests that are more likely to be positive for you. In the same breath, if you are going to be waiting to test, there is no reason to spend your money buying a more expensive pregnancy test when the regular one will do the job just fine. So when do we recommend that you actually take a pregnancy test in the 2-week wait? Well, embryo is entering into that uterine cavity again, typically around day 5 to 6. And we generally say that implantation window is in the big range, days 5 to 9. I typically say it's more realistically probably days 7 to 9. But essentially, a week after ovulation, you're going to be at the place where the embryo is going to start implanting and HCG can start to be produced. And then that HCG is going to approximately double every 2 days. So we typically want to give it a few days to get to a high enough level to see it in your urine. The perfect time to take a pregnancy test, if you want to know for sure, I want to take one test and I want it to be positive or negative, and I want to trust that result, would be 2 weeks after ovulation or the day that you would expect a period to come if you are not pregnant. And that's why a lot of people will say, wait until you've missed your period, because that way you might not be wasting money on tests, or you might not be obsessing over lines ahead of time. But in the vast majority of normal pregnancies, you will get a positive on a urine pregnancy test before that 2-week mark. So if you are tracking, you can start to take one earlier. I typically don't recommend taking a pregnancy test before about 9 to 10 days after ovulation at the earliest. I know some people take them earlier, but it can be negative and you can still be pregnant. Remember, HCG has to get into the urine, and then depending on other variables like how dilute or concentrated it is, you may or may not see a positive or negative. So I usually would say day 9 to 10 is a good point. The earliest I would ever say is typically day 8, unless you are testing out a trigger or doing fertility treatments and somebody gives you different recommendation. I will say it's important to know that when we do an IUI, we're doing this on the day of ovulation. So essentially 2 weeks from an intrauterine insemination is when you should check a pregnancy test. But if we're doing an embryo transfer, it's a little bit different. So when we put the embryo into your body, if we have a blastocyst embryo, that embryo is at day 5. You're essentially 5 days after ovulation already. And so we check pregnancy tests typically about 9 days after that because we're already 5 days in. Also, if you had a day 3 embryo transfer, which is not nearly as common anymore, but it could be, you would see that a pregnancy test is typically checked about 10 or 11 days after that. So what we are doing is trying to still check based on when you would normally miss a period because we have got standard levels of what blood HCG should be around that time. Now, if you are getting blood levels drawn in this 2-week wait, what's a normal HCG level? We really like it to be around 100 at that 2-week mark after ovulation. That's a really nice, reassuring number. Even more than 150, even more reassuring. Anything over 50 is truly a good number, and it is okay. Levels less than 50, though, have a higher likelihood of not progressing normally. With that being said, I have had people have perfectly normal babies whose HCG started out extremely low with very well-known dates, meaning we know exactly when we put that embryo back in the body. I've seen HCG levels as low as 7, 9, and 11, all make it to perfectly normal babies. So if you are going through treatment and you do get a blood HCG and it is a low value, don't let that convince you that it's never going to be and make some decision that could be harmful. Notably, don't stop your progesterone unless your clinic is telling you to. Typically with those low levels, we tell people we're going to be really cautious here. This is not quite as high as we want it to be, but it doesn't mean we're out of the race. We want you to continue your medications, continue your progesterone, and we're going to repeat it in 2 days to make sure to see that it is doubling appropriately. And if it does not, then we will stop your medication and see if this pregnancy can resolve so we can get on with another treatment cycle. Remember that progesterone is supporting that early pregnancy. And this is why there's always that chicken and egg hypothesis, because a normal pregnancy growing and dividing makes more and more HCG. That is going to stimulate the corpus luteum to make more and more progesterone. An abnormal pregnancy is not growing and dividing normally. It is not going to stimulate as much progesterone. This should not be enough to support a pregnancy and is the sign to your body, this pregnancy is not going to make it. You're a human and can't be pregnant 100 times. So we're going to miscarry this pregnancy and try again with one that hopefully will grow and divide normally. So the relationship between progesterone and HCG and miscarriage is actually pretty complex. But if you are on progesterone from a clinic, it might delay when you're going to bleed, and it might be keeping a pregnancy that's not normal from bleeding or miscarrying. And that's why your clinic might tell you to stop it if the HCG levels are not rising appropriately. So what do I recommend that you do? I think number one, if you're trying to get pregnant, and especially if you have infertility, it's really important to think of a game plan. The social aspects, the emotional aspects of the 2-week wait can start to feel very overwhelming. So let's dedicate extra time to taking care of ourselves because our body is worth it. So think about stress coping strategies, number one. What are you going to do for you every day? Think about this before you get into the 2-week wait. Are you going to go on nightly walks? Are you going to journal, meditate? Are you going to go to counseling? Are you going to go to acupuncture, do some yoga? What is there that you can carve out that makes you feel better, that can help alleviate some of your stress during this inherently very stressful process?